Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. Today, I have a great guest in the building with me, Stacy Wells from Minnesota, doing great work in the state. Stacy, thank you so much for being here. I really appreciate it.
Thanks, Corey. Really happy to be here. Looking forward to this conversation.
Yeah. So, before we get into it, I would love to learn more about you. Can you tell us, about your professional path and kind of what led you to the work in behavioral health and kind of system level leadership?
Sure. I'll give you the edited version. It's long. So originally, my undergrad work was in communications and public relations. And I did that for a while and decided I really wanted to go back to school to get an advanced degree, but um, didn't know what that would look like for communications, and also felt like I needed a career that was more um, was going to give back in some sort of way. And so I decided to pivot into education, and I was in a program where I earned my teaching license and then went ahead and finished my master's in curriculum and instruction and policy. And so I taught for a few years in Minneapolis public schools, and then just knowing Minnesota continues to have really horrible disparities in all sorts of ways, but in education in particular. And what I noticed is with my students, I was in a really diverse school, and when I had student teachers come in, they were prepared great. Like pedagogically, they could deliver the curriculum and all that, but they weren't necessarily connecting with the students, even sometimes when they themselves were students of color. And I started thinking about, okay, how could I have an even greater impact on education and the lives of children than just teaching a classroom full of 28. And while I really loved teaching, it was the most challenging job I've had, but really rewarding. I decided to go into higher ed. And that's really when I pivoted also into diversity, equity, and inclusion work, particularly around education. And then fast forward, was my first opportunity at the Department of Human Services, and I worked in a part of the organization that had deaf and hard of hearing, disability services, behavioral health, a few other areas, and was the equity director in that space. So got a chance to learn more about all of the different ways that Minnesota supports the citizens. Not always in the best way, but providing those sort of stopgaps. But being in a government space, but also in a space where our work in some ways depended on having people that needed those services, like how do we best serve them to not only make sure they get what they need, but lift them out of that. And I wasn't necessarily seeing that work being done. And then when George Floyd was murdered, I was in a space where I was leading that for an organization. I was doing a lot of consulting around diversity, equity, and inclusion, and I was feeling overwhelmed, and also just a great sense of sadness and anger, like many people right around the world.
Right.
Really. And I needed to step away from that. And while I continued to do it as a consultant, I kind of pivoted and went back to communications and back to education, actually, and led the communications department for in a school district. And then a couple of years into that, I got a call from DHS asking if I'd be willing to come back and help stand up a new health equity department in a different area of the Department of Human Services, which is where I am now, the direct care and treatment space. And direct care and treatment, we offer the state mental and behavioral health services for anyone in Minnesota who other institutions can't or won't take care of. We also have individuals that are civilly committed. We have the Minnesota Sex Offenders Program. So it's a very focused patient and client population. And we serve about 12,000 folks in Minnesota a year, about 5,500 employees. And my work now is leading the health equity department as well as the learning and development department. So it's been, I feel like I've had some really great opportunities, and I kind of fast forwarded through that, but I tried to make sure that as I kind of took on roles that didn't necessarily seem to like logically line up, they did give me opportunities to move into leadership, take some experiences in my education, and move it in a different direction, and always sort of connecting the dots around all the different disparities that we have in Minnesota, and hoping that, in some ways I could make a bit of a difference in that. That's really important to me. I am not so much driven by necessarily a title, or, I'm working in government, so it certainly can't be money. But really, I'm a very purpose driven person. So anything I think that will help me make a difference is what I aspire to. And, I guess that's yet to be seen.
Yeah, and you almost, in a way, you answered my next question. And it's similar for a lot of people that I know that are, what I call like your non-traditional public health professional, where you started off in one career path and now you've kind of married both, where you started off in education and now you're in this other space. Not where I'm sure you probably thought your career would be, but it really kind of marrying the two. How do you feel your experience in education, in that role, and now your role, with, kind of like a healthcare public health position, how do those kind of inform each other? How do they work
Yeah.
together?
That's a great question. I think about that a lot, actually, because, coming into, while I was at DHS before, it wasn't in a healthcare space. It was, it was really about, I felt like my job there was really focused internally on the workforce, not as much of the community part, and not about the services as much. So coming into direct care and treatment, I admittedly don't have a lot of experience with healthcare, but what I do know and what I've researched is about the, healthcare inequities and health
Mm-hmm.
inequities. And what I also know is, when I think about children, they often are, schools and children are indicators of sort of what is coming into our society, right? So that's where we see families that are sometimes in crisis, maybe because of what's happening with the kids. It might be students that are in special education and need additional resources, and the family is trying to figure out how to get those resources so that their child can show up and learn and be, a full participant in their educational experience. I think about like the social workers and things like that. So it's all of our services and all of our social systems are interconnected. And so what I knew was, the things that were affecting how kids showed up in the classroom and the services that they got. And that really did help inform the types of things that I think about being in this space. Now, the challenge sometimes is understanding this particular population of individuals that, in many cases, have done crimes based on sometimes their mental and behavioral health, right? And
Mm-hmm.
that's a space where people are like, why do we care if they are treated equitably, or if they're having good health outcomes? And it's like, well, they are still people. And
Mm-hmm.
in many cases, these individuals maybe did not actually do the things that they said they did, but they were having some sort of episode, and thought they did something, or they maybe were involved in the criminal justice system and were told, if you say you did this, right, we can create a deal. We have some situations like that where individuals are involved in the criminal justice system. And while we're not involved in that necessarily, but that's just to my point of, they're still individuals. And, while they're in our care, they should still be well taken care of in terms of making sure that their cultural needs are met.
Yeah, that sounds, and you kind of touched on kind of the very, specific population that you serve, which can be interesting at times. I can only imagine, what motivates you to stay in this line of work, especially when maybe the challenges may feel a little heavy.
Mm. Yeah, especially nowadays, right? There's just so many, like, working in the diversity, equity, inclusion space. There are have always and will, I think, continue to be challenges.
Mm-hmm.
But right now, with this presidential administration, it is especially challenging. But I think one of the things is that I'm just really curious. And so I guess the more personal part of it is that I'm continuing to learn. And so while I've been a DEI practitioner for years, I haven't been again in the healthcare space. So this is, it keeps me interested because I'm learning more about that. I think the other piece is just knowing that in our hospitals and our care centers, we mirror the disparities across Minnesota. So we have more African American and Black men and Indigenous or American Indian men in our facilities. It's, than we do in our population. So it's, there's an overrepresentation of them in our facilities. And so again, we're seeing those disparities, and it's just something that we have to address. We have a workforce that does not at all reflect Minnesota in terms of just, who is in our state. And so how do we continue to try to improve that? But while we're doing that, how do we make sure that those folks that are in our that work for us, our nurses and our physicians and therapists and things like that in particular, that they understand the importance of that cultural care that they should be providing to whoever shows up in our facilities. So I think those are the things that keep me there. I don't spend a lot of time with the patients directly, so I don't necessarily have, the way I don't have those kind of relationships the way I would, let's say, in a classroom or in a higher education space. But I do know who they reflect, and I have a good idea of the sorts of people that are in our institution, and really can only imagine the sort of, trauma and the experiences that they've had in their life that they ended up in a space that they would have never chosen to be in.
Right. I mean, you touched on so many very important things there, and I feel like some may take it as, oh, you don't think I'm good because you don't feel like I could talk to this person who doesn't look like me. And that's not even the case.
No.
It's just the truth. I will trust somebody more that looks like me.
Right.
And there's nothing wrong with that. But at the same time, because of the states that we live in, it's more likely to get someone that doesn't really look like you.
Exactly.
So for those professionals, you have to know that's the case. So I feel like there are times where there's more pushback to educate yourself on different cultures, because it's almost looked like you're disrespecting me in how I perform my role, which
Right.
is not the same thing.
Yeah.
And you just don't know the little nuances of how I talk or what I say or how things work. And that makes me not want to talk to you.
Right. Well, and what's so interesting about that is this is something that I thought a lot about when I was teaching, and I would share this when I do, speak with teachers still or educators. I, as a teacher, I took so many courses, right, or professional development opportunities, and have even provided them about how to teach students of color.
Mm-hmm.
We know that I have never had a course about how to teach white students, because that's the default. That's who we teach. That's what the system was built for, right? So when I'm working with white professionals or even professionals of other cultural communities, and they kind of are resistant or feel like, I'm good at what I do, and I always remind them, unless you can serve everyone that comes in front of you, then you are not doing the best that you can do. And this isn't really a question about what you've learned in terms of like your studies, but if you don't know how to communicate, like you're saying, with anyone that you're coming in, into connection with around your expertise, if you don't know how to talk to them and try to understand them, and no, you're not going to know everything, but you're going to be open to learning more, being curious, trying to meet them where they are, and letting them sort of lead that conversation. I mean, that takes some humility, and there's a lot of folks that just don't have that. They're just like, this is how I do it, and it's going to work for you too. Well, no,
Right.
that's not true.
It doesn't work that way. And I
No.
can tell you, I can look at how, I talk to my kids. I can say the same exact thing in a different tone and get the same outcome, but I know I have to say it to my daughter differently than I say it to my son. You know what I
Right.
mean?
Yep.
And if I say the same thing to my son that I say to my daughter, I'm not going to get what I want.
Right.
It, it's just that simple.
Yeah.
So it's like it's it's a little frustrating when you have these very smart people who are professionals, and they're
Mhm.
just too sometimes, I'm just calling a spade, too hard headed to help everybody in different ways or to learn
Exactly.
something different.
Yes, exactly. And it's, yeah, it's a little bit more work, but the more you do it, the better that you get at it, right? And it's like we're
Hmm.
not looking for perfection. One, we're acknowledging that we're not all of a sudden, especially in places like Minnesota and Iowa, going to have, an adequate number of diverse folks in our different, professions. It's just not going to happen that way.
Hmm.
That's why we're trying to prepare everyone that is there to be able to engage with those people that you meet, until we can get more diverse people into those professional spaces. That's just what we have to do. And yeah, if you're just not willing to do that, then you should probably rethink being someone who is working with others. Just
Right. Right. Right.
respectfully.
Exactly. Exactly, man. I kind of want to touch on something real quick. um how do you feel, how can organizations, ensure that people with lived experience are a part of designing and evaluating care?
Mm. Yeah, that's a great question. I feel like it's something that organizations talk about because, like we know now that that's a best practice, but it's really hard to do because what you're saying is, you know, I need to pause and invite these people with lived experience in and actually listen to them and let them guide the conversation and provide the solutions. And then I need to figure out how to make that work with in terms of resources and going into the community. And I think sometimes one, we have people that are afraid to go into the community or to
Hmm.
engage with those folks that have lived experience, whatever that may be, especially if it's a situation where they either haven't had the experience or the people having the experience don't look like them, right? It feels kind of uncomfortable. But I think it really is about like some participatory community outreach and not going to them with a solution already in place, but going to them genuinely and saying, we know this is a challenge. This is, can you tell us what your experiences are? What do you need? And how can we work together to get there? And, if you have boards, inviting some of those people to sit on your board, if you can hire them in some capacity, I think that's really important. And then just really building those genuine relationships, not like a one and done, not going back and saying, okay, this is what we heard you say. Here's what we're trying to do. Is this what you meant? Are we going in the right direction? And if they say no, to not be like, oh, well, this is what we're doing now. But to go, okay, well, let's stop. Let's pause. What do we need to like? Okay, so what do we need to do differently, right? So just really being receptive to their involvement and their feedback, and knowing that their expertise that they're bringing may not look like yours. It may not look like a degree or a title, but it is they are living closest to the pain, or they are the ones that are living that experience every day.
Yeah, and I bring that up because I feel like we talk a lot about um, system change and policy and civic engagement, um, and it's always from a level of this organization feels like, based off our community needs assessment, this is what we should do. And and then which I think community needs assessments are very important, and I wholeheartedly support them and are behind them. But what does that look like with, when the is that the whole community, and it's there's so many different challenges with that, and I believe when we wholeheartedly listen to the community, and we take our time with understanding the community, it may not be one, the outcome that we think, or the solution that we think. And there's sometimes, just based off my own experience, there is some hesitancy to go with the solution that the community is saying.
Yes.
Like, oh, I hear you, but
That's not what we really had in mind. Thank you for that feedback.
yeah, it is like
Because
you have all this great
make me
data.
go better. I'll never forget this example. I don't even remember where I heard it. I'm sure probably in graduate school, but it was a really simple example. This was a higher education institution that wanted to enroll and support more Latina women with children. And they said, oh, we'll provide childcare. And so they did. And they were like, wait a minute, they're not using our childcare. They're still not coming. What's going on? And some of the women were like, we don't know those people. We take care of our own, or our friends and our family. Like, we don't want your childcare, but maybe you can supplement us to take care of our own children. And it was like such a simple thing. And like, it was kind of in the right direction, but they didn't ask, okay, if we provided childcare for you, or like, is this a barrier, childcare? Yes. Okay. What does that need to look like if we provided it for you? They didn't go deep enough, right? They just were like,
Right.
oh, childcare. Because childcare is kind of universal, right? Everybody's like, oh, I need childcare. So they were like, we got it. And they didn't quite get it. Now, when they made that little change, it made all the difference in the world. And I was like, and it is sometimes sometimes it's that simple, not always, right?
Right.
And to your point about like even the community needs assessment, or just assessing things that are happening, how often do we internally say, how are we doing? We're like, I think we're doing great. Well, maybe we should be asking someone else how we're doing.
Yeah.
Because we're not going to necessarily as individuals, and certainly as organizations, it's difficult to hear the things that aren't going well or that we're not doing well. Like nobody wants to hear that, but we need to. But if we only ask ourselves, like, Stace, how are you doing? I think I'm doing okay. I think I'm doing really good at that. That chicken I cooked was bomb. I need to let somebody else eat it. Because the feedback might be different.
Yeah, we need somebody that's not too attached.
Right.
Yeah, but that's so true, and that's so real. And I feel like the more we can, and I say we because I am in that healthcare system too. Yeah. So and I've been a part of these, advisory boards and all that, and I'm always asked about community stuff. And the more I get into it, like I said, I've been doing this. I'm still like a baby in this. I wouldn't say I'm an expert, but the more I am in tune, and the more I'm really kind of able to reflect on what it means to get information from the community, I'm starting to understand, like, we need to be able to also accept kind of the accountability and the backlash from the community, because that's the only way we can get to where we need to be. Exactly. And I think we try to make these decisions so fast, and like, okay, this is we did this, boom, and move on. Well, I think we're moving on too fast from one specific thing.
Yeah, that's such a great point. It's the pivot can be quick. Like if it feels like it's not working, it's like, okay, well, we tried, let's do something else.
Yeah.
Sometimes things take a long time. A lot of the things we're trying to address have been in place for a long time. So the solution's not going to come quick and fast. It's going to take some time. There's going to be, back steps and all those sorts of things. That's like the continuous improvement cycle, right? It's not going to move slowly or quickly and straightforward. It's going to be a little bit more challenging. And thinking about what you said about being within the systems, right? We work within the systems, and I don't know if you do this. I'm imagining so, like, always sort of challenging myself to make sure that I don't get too comfortable and that I don't start to reinforce the things that I say, I think are wrong with the system, right? Like
Mm,
challenging myself to make sure I'm asking the questions, and that if I think that community needs to be more involved, that I'm actually speaking up and saying that, and not going, well, I guess I'll just wait. Maybe this doesn't seem as important this time, but actually trying to stay really engaged. I That's one of those things when you're one. I think it's a responsibility of someone in a professional space, but also thinking around doing diversity, equity, inclusion work. You have to take the risk sometimes to speak up, and that might mean as little as someone being, sort of condescending or kind of brushing you off, to someone maybe threatening your work or your job because you decided to speak up. But if you don't, how are you changing the system? You're really just reinforcing the things that are happening, right?
100%. And, and early on, and kind of, when I was starting to get more asked and get more involved in some of that community work, I was that person that was like, I'm just going to sit back and listen and,
Mm-hmm.
not give my 2 cents yet. And I may have a thought, but like, let me just
Mm-hmm.
sit back and just like figure out where my place is. And there are times where I would hear things and I would have an immediate like, uh, I don't know. But then I would just be like, let me just sit back and feel what's going on and all whatever crap that was going on. It's kind of cringy now to think about it. But the more comfortable I got, with, my role and where I view myself in the community, it got easier over time to be able to, express my thoughts and feelings around some of the things that we were doing. And I'm not gonna lie to you, Stacy. There were times where someone would say something, and everybody was like, "Yo, that is great!" Like, and I'd be like, "Wait a minute,
Is it? Is that
is
right?
it really?" And you can just tell, like, everybody's like, "Oh," but half the time it's like, you know what? That is a good point, and that's why I think it's so important to have um, people of color in these roles, even when it feels like you're the only one. Sometimes, because sometimes I was the only one,
Yes.
and it's you feel that weight on your shoulders to have to speak for everybody of color, and you know what I mean. Like, it's just that innate feeling of I'm the only one in this space, therefore I have to think for everybody.
Mm-hmm.
Which is not true. Not everybody's the same, but that's just the feeling that I would have sometimes. And it was like, okay, I have to, even though everybody in this room is in agreement, or thinks this is the right thought, I have to say something to give kind of a counter to that. Um, because if I'm silent, then I'm in agreement too, and I really wasn't.
Yeah.
So so I'm getting better at that for sure.
Yeah, me as well. I mean, because sometimes it's calculated, but it's so easy to kind of slip into, okay, well, I guess I won't say anything. And then, sometimes saying it in the, like, to an individual might feel easier, but it sometimes really does need to be said in a large group when there's just kind of like you're saying, where everybody's like, yeah, that's great. You're like, well, let's at least consider this point, and I think it also models like that courage for some other folks that maybe, even white folks that are like, I feel like I should say something, but I don't want to.
Yeah.
And when they see us doing it, it's like, okay, maybe next time I'm gonna do that too. Or even in that same situation, they might speak up and say, well, yeah, that's a good point. I'd like to hear more about that. Anything we can do to sort of interrupt, right?
Yep.
Sometimes it still might end up happening, but hopefully someone at least is walking away thinking, okay, maybe we should be thinking differently about what we're doing next time.
Yep,
you know?
100%, 100%. And I want to talk about you. I know you are, a DEI practitioner, and you've been doing this work for a very, very long time. Um, before DEI was even a key phrase everybody spoke about,
Right.
right?
Right.
I would love to get your thoughts on kind of the climate around DEI and equity.
Mm.
The language around equity and inclusion has become, as you're aware, like politicized
Yeah.
in some spaces. How do you continue doing the work when the climate is super tough?
Yeah, I think one of the things is I remind people that although the words are really politicized, they're not illegal. And, it's like just because someone decided to put them on a list does not make them illegal. And all the reasons that we need to be doing this work still exist and are probably getting worse again because of our current climate. And, I feel like many people have said, there's a lot of organizations and individuals that are sort of complying in advance because they're like, oh, well, this is the direction we're going.
Hmm.
We got to stop doing this work. That's not resistance. That's not how we're going to change anything. And I think the other thing is when we think about the laws that have been in place, right? Like around civil rights and human rights and all those things, those laws still exist. And our work in diversity, equity, and inclusion is directly related to those things. Those are compliance. Those are the things that people can litigate around. Our work is to try to help people understand why those laws unfortunately exist and to do better so that we can not have situations where people are still being discriminated against and experiencing racism and sexism and all the phobias, and to try to help people understand who they are culturally, all of us, and what does that mean, and how do we have better, more meaningful conversations about race and about all of the differences that we have and not be so fearful of them. So I think that I try to express how, to me at least, the work is even that much more important. And then in an organization, if a decision is made to stop doing the work, what is the message that you're sending, right, to those that are impacted by it? Also to those people that you've been spending all this time trying to help them understand why we're doing the work and what the words mean and what it looks like, right? Because people's
Hmm.
I have a hard time believing this sometimes when people are like, I don't get it. Like, what does it mean? Like, come on.
Come on, man. Yeah,
You don't want to know what equity means
right.
or what the differences between equity and equality is, like, because we've been talking about this for way too long. But I mean, let's look at this Target. I don't even. They're saying it's not even a boycott anymore. Like Target's done. But it was like they just, for whatever reason, said, and I've heard and read a lot about the things that they're still doing and how they were just changing, and maybe it's a change of language. None of that mattered when folks were like, oh, okay, Target's not going to do DEI anymore, then we're not going to do Target anymore, right? Because
Hmm.
the message that it sent was, you don't care about us and you no longer are supporting us. And so maybe what you were doing was performative from the beginning. And so, you know, it's people's individual decision whether they want to support Target. I mean, there's a lot of places we could be boycotting,
Right,
and
man.
maybe should. But I
Right.
think that that was a real strong sort of reaction, or continues to be, to an organization that thought they were doing something because they had to, and because they were trying to maybe avoid something that really they didn't need to. They could have just kept doing business as usual if they were really committed to it and publicly doing that the way that some other organizations have. And we never know if it's performative or not, to be quite honest.
Right.
We just don't, right? There's a lot of organizations that have put out statements that said, oh no, we're not going to stop doing DEI. But if you talk to people maybe who work there or look at other things that they're doing, they're just as harmful. So, we got to use our better discretion. But our work around, particularly equity, racial equity, we have so much further to go. We have nothing solved. And yes, things are better than they were at other times, but we still are not at a place where people really are, achieving success and have health equity or are getting the best education that they can, right? Over the last, 2 months, I've been reading about Black women losing their jobs at
Mm-hmm.
I think it's over 6%. The disparities, I mean, I think this current climate allows for these things to happen in a way that they were happening in the past, because there are people that are very blatantly saying, we don't care about you, and we're going to do anything that we can to get back the America that we think is great, whatever that may be.
Mm-hmm.
Um, but we still have far too many disparities in our society to say that we don't need to do this work anymore or that we shouldn't. And so those are some of the things that I kind of hold on to and talk about when people question whether we should still be doing diversity, equity, and inclusion work. And, it's the world that I live. So I'm a Black woman. I show up every day as a Black woman. And while I might have some privilege around, having an education, having a job, I get that. But none of that really matters when I have certain encounters out in the community, right? When I'm going into spaces in Minnesota still that are mostly white, or when I travel and have incidences with people who are questioning whether I belong in a certain space. That's still the life I lead, so I know work still needs to be done.
Man, and that is a lot to carry, and how do you, Stacey, how do you protect yourself in your own well-being while working on these issues, that are deeply personal and systemic?
One of the things that I think about the most is how I have one child, a daughter. She's 21, she's in college and lives in New York. But I just think about everything that I do is so that hopefully she has a better life. And that, should she choose to have children, that they have a better life eventually. My nieces and my nephews and all of in particular, young people that I care for have better and better lives and outcomes than, my great grandparents and grandparents and parents and even myself. I just really want it to be a better world. And, I have come across some really wonderful people in my life of all sorts of people, right? And I feel like there's a greater good. I mean, I feel like in this country, more people than not want to get it right. But there is just something that prevents us from sort of tackling these issues and understanding that we all have some work to do around it. And so I think I guess you eventually develop sort of a tough skin, right?
Mm-hmm.
Especially when I'm dealing with people individually. I try not to take a lot of things personal. If I'm going to ask them to have a sincere conversation with me, I can't take it personal. I have to kind of be open to what they're saying. And I think I care a lot. And I think that we have to do better. And so I try to find ways to um, get involved that maybe aren't about necessarily the work that I'm doing, but I think for example, a lot about now, like the climate and things that I can do around that. Like, what's my responsibility? And then outside of that, just being around good people that, I don't always have to talk about this work. And we can
Man.
talk about
Mm-hmm.
anything else, right? And just like kind of enjoy life and be carefree and have a good laugh, and be in those sort of spaces too, where I'm caring for others and they're caring for me, just how I show up. And so those are some of the ways that I try to care for myself. For a few years now, folks have been talking about, in particular, Black women living like a soft life. And I really, really aspire for that. I feel like that's something that my parents provided for me growing up. I don't know that I've found that as an adult. And so trying to find that and what that means now is really important to me. That whole rest part is important.
Mm,
And just doing things that kind of bring me joy and allow me to still show up in the same way as that caring, curious person every day, and not become too skeptical of what I see happening. Because if you think about it too hard, I feel like I'd walk away from this work, because I can point to a lot of ways where I'm like, I feel like nothing has changed,
yeah.
right? Like we're having the same conversations. And if you think about that too much, it's like, man, that's a wrap.
Yeah, that's right. I'm gonna go into environmental services somewhere. Give me a mop, and I'm gonna keep it. I'm just clock in, clock out, and go home.
Right.
Like, no, I feel that so much, because it can be, and I don't want to speak for you, but just for myself, when you get immersed in this so much. I do it as my, as a professional within the healthcare system. I do it, in my free time, with my podcast, with my nonprofit, and it's almost like it's hard to escape, because I also want to stay in tune in what's going on. So I'm reading about it, or I'm watching videos about it. And it's like, I don't watch Love and Hip Hop, but sometimes I'm like, man, let me just talk. Let me just, back away. At least what ignorant stuff is going on over here on this side of the internet. Like, I need to get away from it, just for my
Yes.
own sake.
Yes. Yes. But I feel like I 100% agree with you. And I would say there is something really special about being Black, because Black folks can, like, the humor and joy that we can find in life.
Man,
I mean, it
unmatched.
unmatched, seriously. And so, like, sometimes I remind myself what, like, I am really proud to be Black, what a joy and a blessing, even with all of the hardships, right? Like,
Mhm.
our lineage is amazing.
Man.
And, so we can find ways to, and I mean, I sometimes I'm like, why do we always have to find a way? But I'm glad that we are able to,
Yes.
because far too many of us have not made it, and so I do think about that a lot, and want to be a part of that and continue to build on that legacy. I hope, and make it better for, first and foremost, for us, but really for everybody, right?
Yeah, 100%. Stacy, I'm gonna leave it with that. That's such a great way to close this. Thank you so much for being on the podcast. For anybody that's listening, or watching on YouTube, and they want to connect with you, where can they reach you at? Where can they find you?
Yeah, I am on LinkedIn, just Stacy Wells. So they can reach out there for sure. Yeah, that'd be great. Corey,
Awesome.
thank you so much. I really appreciate all the work that you're doing. It was great to chat with you. And any way that I can continue to support you or your listeners, I'm happy to do that as well.
No, I appreciate that. I appreciate that so much. Again, Stacy, thank you so much for your time. And everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.